6 News is spending July looking at substance use disorder, and we're focusing on the heartbreak of opioid addiction and providing hope for people who are dealing with it.
That's right. Along with the stories we're telling every Monday, we have some additional perspective from people on the front lines.
And tonight we hear from a certified alcohol and drug counselor. Mariah DeYoung is also the regional director for Pine Rest Christian Mental Health Services.
She spoke with our Kiyerra about what happens after you make that call for help.
Well, Mariah, thank you so much for being here today. Now, you know firsthand about the toll substance use disorder can take on a person, particularly when opioids are involved. But what are you seeing out there right now?
So substance use is still an issue across the board. Alcohol is our #1 concern that we treat the most for, but opioids is growing, and we appreciate the attention that it's getting because this has been a problem for a while, and so we're glad that people are becoming more aware of it and learning about how to get help.
And also, we've done a lot of stories about where people are getting help tackling their addiction, but we don't often talk about what happens once they decided to seek help. So what's the process like when it comes to these type of situations, and what can people expect?
There are lots of treatment centers here locally that can get you in and are very good treatment. But when you do get in, you will start with an assessment depending on what level of care you need, either an assessment with a nurse, a medical provider, or a therapist. And they'll make recommendations at that point, whether it's something where you need to stay 24/7 and be medical monitored in like a detox or a residential program, or it's an outpatient program where you come for the day or you come a few times a week. You'll meet with a therapist or a medical professional that will make that recommendation. Detox, which is usually 3 to 5 days, that's our most intense, where you're monitored medically to make sure you can safely go through the withdrawals. Then there is our residential program, which is usually 2 to 4 weeks. People can stay in our short-term residential. Then there is our outpatient partial, where people just come during the day and go home in the evenings. Then the step down to intensive outpatient, you'll hear that sometimes called IOP. That's usually 4 to 6 weeks. And then there's the outpatient programs from there, which are a variety of different groups and individual therapy, and then there's medication management through all of those levels.
And let's talk about the availability of help that's out there. Are there enough resources out there for everyone who do want this?
There's more than what people think. And that's why I say it's really important to call, even if you're just going to call and ask questions and you're not ready yet, but call and find out your options. I know at Pine Rest, we can usually get people into services for detox or residential within 24 to 48 hours, and for outpatient within a week. So there, you can get in pretty quickly. It depends on different programs, different insurances, so I can't say for everybody, but you should not be waiting weeks or months. There should be availability. Come try it, see what you think, because it's not as scary as a lot of people think. I hear that over and over again from patients, that they were so scared to make the phone call, they were so scared to come in, and they got here and it was the best thing. So give us a chance. Try, come in, talk with somebody, figure out your options, but nobody's going to make you do something you're not ready to do. We have a family program that family members can be part of, even if their loved one isn't ready for treatment yet, so that they can help understand what's going on. And when their loved one is ready for treatment, they know what to do and they know all the steps. So I encourage, if you're struggling with substance use yourself, to call, and if you have a loved one that you're concerned about, give us a call. There's lots of options to treat everybody.